The likelihood of more pandemics emerging is not really in question, and the frequency of that may happen more often.
We've got to recognize that these are existential threats to humanity in the same way that some of these conflicts represent existential threats.
So we need to take the opportunity for the inter-pandemic period to really not lose sight of the lessons and really engineer our systems to be more responsive.
The scientific and technical response to COVID-19 delivered effective vaccines, diagnostics, and therapeutics at record-breaking speed to wealthy countries. But these life-saving tools have yet to reach many people in LMICs, lower and middle-income countries. Meanwhile, the pandemic persists as variant viruses continue to emerge. To prevent another such disaster or worse, every global region must be able to produce disease-fighting tools before we face another pandemic threat.
The number of doses produced last year, as I said, was phenomenal. 10 billion doses. It wasn't distributed equitably. And part of the reason was that the countries that did not have vaccine manufacturing on their soil actually were in a disadvantageous position.
If we're really going to prevent the next pandemic, it's going to have to put equity front and center, and that means empowering the LMICs from the beginning, not as an afterthought.
What is happening now is that communities, groups of countries, regions have decided that they're going to develop research and development. They're going to create capacity for production, and then most importantly for distribution and getting the therapeutics or the vaccines or the diagnostics to the people who desperately need them.
The regions who are closer to their problems, understand their problems better, can actually find solutions.
Targeting a novel epidemic disease with a swift vaccine response can prevent it from becoming a pandemic. Meanwhile, globally distributed infrastructure that would make such a response possible can be used to create vaccines against diseases that cause high rates of illness and death within certain regions of the world. Due to the limited market for these vaccines, they have not been pursued by pharmaceutical companies. Now, thanks to advances in vaccine platform technologies proven during the response to COVID-19, LMICs have the potential to design, produce, and distribute vaccines that meet their health priorities as well as respond to pandemic threats. Realizing this potential will stimulate educational and economic development opportunities that build a more prosperous, equitable, and secure future for all.
We need those LMIC vaccine producers, and they need to be empowered, and they need to have the adequate funding support, and we need capacity building for additional technologies.
If you want to ensure access and equity, then that's an area where we are massively underspending.
Influenza is a promising first target for regional vaccine development, as every year it causes significant illness and death throughout the world. Vaccine technologies, factories, and distribution networks that provide ongoing protection against seasonal influenza could quickly respond to new influenza strains that threaten to become pandemics.
The hope is that we already have a network of, for example, a network of manufacturers that would be able to come to the rescue very quickly and pivot and be flexible to be able to ramp up, in this case, for example, an influenza vaccine. That we already had pre-designed on the basis, again, of the fact that we have a surveillance network that can prepare us to have it ready. But for that to happen, we have to make sure that we equalize that manufacturing network, for example, where we have hubs of manufacturing capacity, distributed equally around the globe, not only in the high-income countries, but also quite well-versed, around, the entire world.
Investing in sustainable and resilient systems to develop, distribute, and deliver vaccines will improve global health and drive economic development, benefits that will multiply as people and countries become healthier and more economically secure. Now is the time to invest in the equitable expansion of pandemic responsive technologies.
We need to strengthen existing entities. Bodies like the World Health Organization, we have to recognize the very important role that they play and enable them and support them to play that role even more effectively.
What we are looking for is really a comprehensive structure that brings together multiple stakeholders to ensure that we can do the best possible to protect the world from the ravages of disease. If we can get all of the member states of the WHO or other groupings to agree to this, I think we will be taking a step that allows us to shape the future in ways that we couldn't have imagined 3 years ago.
But the existing system is very much a colonial system of rich countries choosing to gift when there's a crisis. And we have to move away from that. And so there are some countries which are low and middle income countries that have chosen to direct greater resources to their own health systems. And it's having an impact. Now, those countries should be rewarded through the new financing mechanism that is going to be created for pandemic preparedness. And they should get their funds matched so that there's an incentive for them to readjust their budget.
So it's not about donor funding anymore alone. It had to take, unfortunately, global pandemic for the health sector to realize that the financing needs and approaches have to change. I think the key thing is what we learned in this pandemic is that to establish a new health financing architecture, we need to make sure it's an inclusive, transparent system, which we didn't have before, and that accountability mechanisms are in place. So in order to have countries in the G20 and plus to commit to put money in a multi-annual basically budget stream to such a fund.
I think that begins then to change the way in which global health resilience develops. It's not like a tsunami where some natural disaster occurs or an earthquake and you've got to go in with emergency aid and emergency funding. We know what we're facing here. Many countries are still living through it.
We're all in this together. If you're living in a house and one room in the house is on fire and you go to the other room and you close the door, it doesn't mean that the house won't burn down. The virus doesn't care or respect borders. Our health future is linked, our economic future is linked, and those two things are interlinked and inseparable. So it's in all of our health interests and collective economic interests to be working together to solve these problems.
Our role as advocates is to absolutely knock on everyone's door, as we've been doing over the last several years, to make sure that health is at the top of the political agenda. And I can tell you politicians are now listening to it because they cannot be in a situation where on their watch they have another COVID-19. And so there's all the upside of preparing for relatively little cost, but there's a massive downside if you haven't prepared. And so we'll be using all the skills and techniques that we have and the networks to make sure that people are listening to this. And if it involves screaming, we can do quite a bit of that too.